Well, it has been 6 weeks since the Hospital Sisters Health System announced the closures of Sacred Heart and St. Joseph's Hospitals in Eau Claire and Chippewa Falls, as well as all 17 Prevea clinics in western Wisconsin.
Since that announcement, smaller regional healthcare providers like the OakLeaf Medical Network have been scrambling to fill the void as HSHS winds down its operations, going as far as offering to take over both hospitals. But with no deal in sight and an April 21st deadline approaching, those providers are shifting their focus from negotiating to taking on the void all by themselves.
And our own Michael Germain spoke with the president of the OakLeaf Medical Network today about their plans to try and move forward without HSHS. Good evening, Michael.
Yeah, Ken and Emily, last month the OakLeaf Medical Network offered to sit down with HSHS executives and develop a plan to keep emergency services available for the residents that live in Chippewa Valley. But as the weeks have inched forward, OakLeaf doctors say HSHS never came to the table, and to date no plan has been finalized. Now, OakLeaf executives say they and other small providers are moving forward with plans to fill the void all on their own.
There's a difference between the building and the land and actually the medical component.
Taking over a failing hospital isn't an easy task.
We needed from them is we needed cooperation. We needed them to sit down at the table and provide us with access to their Medicare license, to provide them with the CMS certification that was needed to continue the services until we could put those pieces in place.
But OakLeaf Medical Network President Kyle Dettbarn says HSHS representatives never responded to their offer.
We essentially did not hear anything back from them.
And with the April 21st deadline approaching, healthcare providers in the Chippewa Valley are taking their own measures to keep patients healthy.
We've extended our hours in the clinic here. We've extended access to our providers. We're in the process of hiring Prevea providers to keep them in the area and to keep these primary care patients with the doctors that they want to be seen.
Dettbarn says his priority has shifted from negotiating with HSHS to developing short, medium, and long-range plans to fill the void when HSHS finally closes. In the short term, taking care of emergency room patients is top priority.
For patients that need care now. We're also looking at options in regards to providing cardiology care or cardiac care.
The long-term solution he hopes to see is an entirely new hospital, staffed with former HSHS providers who have been serving patients in the region for years.
The problem is this stuff does not happen overnight. It takes time, but we're actively involved in doing all of the above.
Now, Dettbarn also adds in a perfect world, they could break ground on a new hospital within the next 2 years. But as we all know, a perfect world doesn't exist. Ken and Emily, back to you.
All right, thank you, Michael.